Hi, Temple. Thank you for joining us for Forensic Nurse Week. Uh, I'm Alfia Nuevo, the Peer Education Program Assistant at the Wellness Resource Center at Temple University. Forensic Nurse Week runs from November 3rd to November 9th, so spread extra love and support to your community's forensic nurse. Today, we are joined by Dr. Laura Sinko. Would you like to introduce yourself?
Sure. Hi, everyone. My name is Laura, Dr. Sinko. I'm an assistant professor in the nursing department here at Temple's College of Public Health. I also work at the Philadelphia Sexual Assault Response Center, which is located in North Philadelphia.
Thank you so much for joining us. I'm excited to hear more about forensic nursing and its impact on the Philly community. Let's dive right in.
Absolutely. Let's do it.
Yeah. So some of our viewers may not know about forensic nursing. Could you give us an overview and its influences on Philly?
Sure. So, forensic nursing is a specialized field of nursing that combines healthcare often with the legal system, but not always. So, nurses provide medical care to victims of violence, and we also are collecting and preserving evidence for potential legal proceedings. Although folks can come to us anonymously and choose not to report, and we can still care for them. What makes it unique is this dual role of being trying to be a compassionate caregiver while also trying to really meticulously gather evidence. And so it really can often try to bridge that gap between healthcare and the criminal legal system.
Thank you. That's really interesting. I'm glad that there are professionals that bridge that gap.
Mhm.
Regarding the forensic exam, what would students um, be or expect from this type of examination?
Yeah, so when you come for a forensic nursing exam, often you've experienced some sort of violence or harm. We typically do these exams within 3 to 5 days of those experiences. And so often that involves documenting injuries, collecting different evidence that could support a case if you choose to go that route, and having medical care in an outpatient environment. So we're really focused on what do you need for your health and how can we help you feel safe in your own body in that moment to the extent that we can. Make sure that we treat any injuries and then give you medications that can prevent different sexually transmitted infections if that's appropriate for your case or other preventative care measures.
Yeah, that's very honorable that you're able to provide that for patients who undergo that type of trauma. Um, Regarding these treatments, when would students come to a forensic nurse for this type of examination?
So, folks would come to us if they experience something that they feel was violent or abuse. Um, and they'd come to us hopefully sooner rather than later. Like I said, within 3 to 5 days afterwards is the best. I mean, the sooner is better, right? We'll do exams within 3 to 5 days, but the sooner you come to us, the more likely we'll have be able to collect good evidence.
Um, I know that you mentioned that yeah, it's best to collect the evidence within 3 to 5 days. However, there may be some barriers that prevent these patients from actually receiving care. What are some barriers and preventative methods that um, can prevent methods that we can in place to prevent these patients from receiving that care?
Yeah, so there are plenty of barriers that people face. And we know it's not easy to come into a medical facility after you've experienced trauma or violence or abuse, right? So many people choose in their survivorship journey to not come to a forensic nurse. And so, of course, we want it's welcome for everyone. We want to make sure you're feeling healthy and well. But barriers folks might face is one, just not feeling ready to talk about their experience in that short of a time. There also could be transportation barriers to getting to the clinic, although there are different options for that around the city. At least there were at WAR, our local rape crisis center. Now, unfortunately, there is a lot of funding challenges with that organization. So shout out to them if anybody has any spare change that they want to donate to that organization, because it's really important resource for our patients. But folks can also face barriers related to not wanting someone who they don't know to look at their body and after an experience that was so violating, right? We know it's not easy, especially if what you experience was sexual harm, and we're going to be collecting evidence. We might be in places on your body that you don't feel comfortable. And that's okay too. I will say we always try with our approach to be trauma informed and to follow your lead. And so just because you're afraid of someone maybe looking at you in a certain area or touching you in a certain area, like as a healthcare provider, we can also still provide care in other ways. So you can still come to us, even if you don't want the full exam. But there are certainly barriers that people face to getting these services. The other thing I will say that people often think is a barrier is cost or insurance. But I do want to just say, while I have the mic, that our exams are always completely free and you don't need insurance. So I think sometimes there's a barrier because you don't advertise that well enough. And so we really try our best to decrease as many barriers as we can. But of course, if you experience something like this and you didn't do a SANE exam or a forensic nurse exam for whatever reason, it's not your fault.
Yeah, that's really interesting. I'm very glad those exams are free and are readily available throughout Philly. Regarding uh, I guess the, I guess the advertising of these treatments, how do you recommend someone like students who may have seen or heard of either a peer or other student that may have experienced interpersonal violence? How do you recommend they interact and support these victims?
So oftentimes I think the best thing is to just listen, believe them, and be available for support. Sometimes when people experience trauma, it can be really hard to make decisions because our brains can feel very scattered, or we could be feeling a lot of emotions. And so, if you do have resources at your elbow, if you know about the Philadelphia Sexual Assault Response Center, you might offer to provide a ride for them if that would be important to them or helpful to get them there. But ultimately, honoring their choices. Not everybody wants a forensic exam, and it might not be appropriate in some cases for people if that's not what they want. Maybe people want counseling instead, or in addition, or maybe they want some time to process. And so I would really honor people's choices and experiences while also letting them know that resources and help is available.
Yeah, that's a very important advice to give to students. Respecting autonomy is a very difficult choice in respect to wanting to help people. Um, Regarding wanting to help people, how can educational institutions promote safety and support for people who are impacted by interpersonal violence?
Well, I think here at Temple, we're really lucky to have the Wellness Resource Center. I think y'all do a great job at talking about these things, providing a space where survivors can find resources, where students who maybe aren't survivors but love or care about a survivor can find resources. And I think that's really important. I also think at myself as a professor, we need to be very thoughtful about why people might be showing up the way they do in class. Not everyone's going to tell us what's going on. But I think being open to when students are having challenges or they need to miss a class or something like that, I think the more compassionate we can be and the more we can work with students who are going through trauma, I think that makes their healing journey a lot easier. And I think in general, we have to recognize that trauma manifests in all sorts of ways, and people's behaviors might change after trauma. And I think really being curious, and sometimes those behaviors can be challenging as an instructor, as a friend, to watch, but being really curious about maybe not like what's wrong with you or what's going on, but like what might have happened to you that is sort of having you act or feel this way. And then how can I help support you through that?
Yeah. To build off that, how do you recommend one to actually practice language and media literacy around topics of interpersonal violence in shows or entertainment?
Yeah, so I think if we zoom out a little bit, right, and we think about our media consumption, it can help us realize why we might have certain biases in our head, or maybe why we don't recognize unhealthy relationships when we see them. So we might want to start by just actively questioning what we see. There's so much out there that we can consume on social media, on TV. So thinking about whether portrayals of relationships actually show things like mutual respect, consent, healthy communication, or are they really normalizing these like controlling or violent behaviors? And so it might be helpful to discuss this with your friends, call it out, make fun of it if you will, or just be like, this isn't normal, this isn't right. And I think the more we can really question those things, the better we can feel equipped to recognize these things when they happen in real life and share our concern with people when necessary.
Yeah. You mentioned the difference between healthy relations and violent behavior. What are signs or what are, I guess, green flags for a healthy relationship?
Yeah, I think when we're thinking about healthy relationships, we're really thinking about ways that people in our lives show up for us that make us feel like our full authentic selves, ways that we feel like we can trust people, we feel seen, we feel heard, we feel respected, we feel understood, we feel like we're allowed to make mistakes or we can say how we really feel and there's not going to be these ripples of harm or judgment as a result, because violence is not always physical. It can be emotional, it could be mental, it could be financial. So do we feel like we have control over our own decisions, our words, our actions, our thoughts, right? So I think it's sometimes it's recognizing what's maybe not there, some of those red flags and doing that red flag assessment. But then I also think it's to your point, thinking about what are the green flags? What are the things that make me feel safe and secure and authentic to myself?
Yeah, that's really good advice. I think, especially in a college community where people are experiencing different or new things for the first time in their life. So it's very important to still recognize yourself and your values in a relationship.
And it can be
Um,
hard, right? We don't always have great role models, some of us, for what healthy relationships look like. And that's why it can often be very tricky and we can fall into maybe similar patterns that we grew up with or we saw because we don't often have the best models for healthy relationships. So there's a lot of resources online. I encourage folks if they want to sort of think about their own relationships and kind of take stock of how they might be helping them or maybe challenging their well-being, look online for some of these like green flag resources. There's a lot of good ones out there. And I think that that can help if you feel like you don't have a lot of good examples in your personal life.
yeah, I definitely agree with that. Regarding resources, what are some resources that you recommend to students regarding issues with relationships, sexual health, mental health?
Yeah. Well, there's great things on campus, right? We have Tittleman counseling for folks that are looking for more emotional processing. We also have the Wellness Resource Center and some of their relationship programming that I think can be really helpful to think about some of these relationships and meet other like-minded people. But I think beyond that, we do have WAR, our local rape crisis center, like I said, which is unfortunately really needing support and funding. So again, I can't shout them out enough. They are such an amazing resource. But I also think there's a lot of amazing resources online. So we have RAIN, which is our national hotline. We also have the National Domestic Violence Center, and these two organizations have hotlines where you can actually talk to people and go through your experience and get their perspective on it. I also work for a nonprofit called Our Wave, like Our Wave. .org, And on our website, you can share your story anonymously if you've experienced something you want to get off your chest. But you can also ask experts questions about healing, about survivorship, about relationships. And we have our team answer them. And then just to give you some feedback on something that maybe you want a more professional perspective on. And then there's a lot of great on Rain's website, beyond their hotline, they have a lot of web pages where you can read and learn about these different topics from a trusted source.
Oh, I didn't know all those resources existed. Um, all these resources are available and free online.
Yes.
Nice. Yeah. Students should definitely look into them if they're needing assistance. Um, but uh, with these resources and all this, I guess, people behind this work, why are we still seeing interpersonal violence within our society?
Yeah, it's a great question, right? A lot of these resources are really to support survivors in the aftermath. And I think we're doing better about thinking about prevention. But I think there's a lot of entrenched things in our society, things like the patriarchy, things like the way, gender roles have been sort of concretized in the way we think about things, the way we normalize certain relationship behaviors and dynamics. It takes a lot to unlearn those things. So I think, in my perspective, if we want to think about decreasing these things from happening, we have to start early, and we have to rethink about the way we talk about sexual education, the way we talk about consent, the way we talk about bodily autonomy. And I think really healthy masculinity and unpacking that, because unfortunately, while men can also experience violence, we know they often cause the most harm, just statistically. And a lot of that has to do with toxic masculinity and those sort of peer pressures at early ages, and also stopping the cycle of violence, right? So many people who cause harm have been harmed. And that's not an excuse. There are plenty of people who are survivors of violence or abuse that don't go on to hurt others. But I do think it helps us understand how these things can be cyclical. So there's a lot of moving parts to it. And I really want to believe that this sort of thing is solvable. And I think it certainly is. But it takes a whole society to really work towards decreasing that.
Yeah, it's definitely um, a part of several different things. And you mentioned how there are gender norms and gender stereotypes that are linked to the perpetuation of interpersonal violence. How do you recommend for specifically young men to take uh, each other into account regarding perpetuating these behaviors?
Yeah, it's a great question. And again, I think men can certainly experience harm, and they do. And I think part of that is recognizing that within yourself when if you're, a man or male presenting, and recognizing when you've been harmed and doing something about that healing journey, and igniting that healing journey in yourself and seeking help when you need it. It's not weak to seek help, it's actually quite strong. And I think we need to be better as a society about messaging that. I also think it's holding each other accountable, speaking up when something doesn't feel right, or somebody is saying something that feels like, give you that sort of feeling in your gut that I wouldn't want them to say that in front of my sister, my mom, my friend that's a girl, or my girlfriend, whoever that might be in your life, if we're thinking this in a very gendered way. um I also think there's something about just recognizing that toxic masculinity is a thing we all grew up with. Women internalize some of these things, men internalize some of these things. And so, really trying to unlearn that and recognize when you're acting in a way that might be perpetuating some of those norms. So, it really takes all of us to end these type of violence and harm. And we need men to be a part of the conversation and holding each other accountable. I think that's often the missing piece when we're thinking about prevention.
Yeah, I definitely agree. Changing societal stigma is a important first step with prevention. And I'm glad you mentioned the WRC because we are trying our best to work together with you and other forensic nurses and other healthcare professionals into, I guess, preventing more harm from occurring. As we're wrapping up this interview, do you have any shout outs you want to give about different organizations or projects that you may be working on?
Sure. So I'll say a couple things. One, I am a researcher, and one of the things that I am always exploring is the healing journey and what that looks like. And so we do have a study that's launching next month to have people use photography to explore healing in their life. And we're going to test if that can help people feel more engaged in that healing journey. So if you are a survivor of any of these types of violence or harms, and you're interested in kind of working with us in this bit of an experiment to see if it would feel better to explore things with photography, please feel free to reach out to me. I would love to connect you with our coordinator to get involved. Also, there's just so many amazing resources, and we're living in a time where we need more funding for these resources. So I'd be remiss to not like shout and shout. We need more funding for our local rape crisis centers. They are so crucial to supporting survivors and provide completely free services. So WAR, Philadelphia Center Against Sexual Violence. Sorry, they changed their name, so I was making sure I got it right. Are fantastic. And so just their resource, if you are looking for a forensic exam, the Philadelphia Sexual Assault Response Center, it's on East Huntington Street. You can Google it, 300 East Huntington Street. We're available 24/7. The exams are completely free. If it feels right for you to come, please do. And then I would finally say, if you are looking for healing and support, like I shared, we do have hotlines available. We have the domestic violence hotline as well as the sexual assault hotline. Those are really amazing anonymous ways you can process things and try to find resources. And then if you're interested in joining a healing community, I already mentioned ourwave.org. And we're always trying to make sure we're building new features to help survivors explore healing online. So there really are a lot of options, and you're not alone. And I think the last thing is really digging in to think about who do you trust and who can you go to, because oftentimes when these things happen, we think we have to heal all on our own, or we feel shame or embarrassment. And so the more you can connect with your community, I really think that can also help as well.
Yeah, thank you so much that for the insightful information, insightful advice. I definitely recommend students into learning more about what Dr. Sinko does and also how to get involved with these movements. There's always the WRC, but there's always open opportunities for um, involving yourself in interpersonal violence, healthcare, and prevention. Um,
Absolutely.
yeah, thank you so much for everyone who joined us at the very end. Once again, I am Althea Anunovo, joined by Dr. Laura Sinko. Um, Remember, you can find us at BeWellTU on our Instagram, and you can also find us on the second floor of the Student Center at Temple University. Remember, be well to you. Bye.